African Americans are dying in greater numbers from COVID-19 across the United States. The country tops the charts with the highest number of coronavirus cases and deaths. The death toll is at more than 22,000 people, with more than 500,000 total cases across the country. But reports indicate that the death toll breaks down unevenly across racial lines.
There's a real problem, and it's showing up very strongly in our data on the African American community, and we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible. And provide support to African American citizens of this country who are going through a lot, but it's been disproportional. They're getting hit very, very hard.
This seems to be a trend in many major U.S. cities, including New York, Detroit, Milwaukee, and New Orleans. According to Voice of America, in Louisiana, 2/3 of coronavirus cases are among African Americans, while they only make up 1/3 of the population. And New York City's 14th Congressional District has been called the epicenter of the epicenter, where half of the district's population is Hispanic. The Guardian states that the risks are that African Americans are twice as likely to lack health insurance compared with their white counterparts, and more likely to live in medically underserved areas where primary care is sparse or expensive. This leads to people at lower income levels to be more susceptible to illnesses, making them targets for the coronavirus. The Center for Advancing Health says that
new research into healthcare deserts find that primary care physicians are especially hard to find in predominantly Black or low-income Hispanic metropolitan neighborhoods.
The Washington Post did an analysis of available data and census demographics. Here's a sample of what they found.
In Milwaukee County, home to Wisconsin's largest city, African Americans account for about 70% of the dead, but just 26% of the population.
And the New York Times reports similar numbers.
In Illinois, 43% of people who have died from the disease and 28% of those who have tested positive are African Americans, a group that makes up just 15% of the state's population. African Americans, who account for 1/3 of positive tests in Michigan, represent 40% of deaths in that state, even though they make up 14% of the population.
U.S. Surgeon General Dr. Jerome Adams, who is himself an African American, told CBS this morning that the number of cases are skewed.
My office, long before COVID-19, has been talking about health equity. When you look at being Black in America, number one, people unfortunately are more likely to be of low socioeconomic status, which makes it harder to social distance. Number two, we know that Blacks are more likely to have diabetes, heart disease, lung disease, and I've shared myself personally that I have high blood pressure, that I have heart disease, and so I represent that legacy of growing up poor and Black in America, and I and many Black Americans are at higher risk for COVID.
And in Washington, D.C., Politico reports Mayor Muriel Bowser as saying,
"The coronavirus pandemic is casting a spotlight on health disparities among African Americans that draw their roots in slavery, racism, and Jim Crow rules and laws."
And some southern states with larger African American communities statewide, such as Alabama, Mississippi, Georgia, and South Carolina, are also seeing similar trends. So, is the data emerging from coronavirus cases an indicator of an already unequal health system across the U.S.?